ATSDR works to encourage the safe reuse of potentially contaminated sites. Brownfield and land reuse sites can be redeveloped safely and, in addition, offer opportunities to redesign the community with public health in mind. Local health agencies are good partners in redevelopment planning. Sites such as former gas stations, dry cleaners, auto shops, and industrial employment hubs provide real and tangible opportunities for health agencies to communicate risks of potential contamination and to consider health and equity. Health agencies can also promote plans that ensure that affected communities not only participate in, but also benefit from the decisions that shape the reuse of properties in their communities, their neighborhoods, and their region. Economic and environmental considerations largely drive land reuse efforts. However, engaging public health agencies early in the process can ensure that health risks are mitigated and health benefits are maximized. Let's meet some of the unique people from federal, state, and local health agencies that have helped make Brownfield such a successful program, and let's listen to some of their stories.
Hi, I'm Laurel Berman. I'm the National Brownfields Coordinator for ATSDR. We believe that public health agencies should be involved in redevelopment from the very beginning planning stages. This is because public health agencies, particularly local health agencies, are uniquely qualified to interact with the community, and they're seen as trusted entities by the community, people where you take your children to go to the local health clinic, for example. They have a special role in that they can explain the risks involved in redevelopment, they can talk about the types of contamination, and they can talk about how people can protect themselves from exposures to contaminated properties. ATSDR values the role of local and state health agencies in land reuse and redevelopment. We've created a variety of tools and resources that are used by local and state health agencies all over the country. These include the Brownfields Land Reuse Site Inventory tool, which is written from a public health lens to help people look at sites that may pose the greatest risk to populations. The Action Model is another tool we have, which is frequently used to engage the community in redevelopment plans in identifying issues and coming up with solutions to those issues that can be addressed through redevelopment. In addition, we're creating a website for health agencies to provide technical assistance for their work in redevelopment. We have funded local and state health agencies for brownfields and contaminated properties as they relate to communities. And finally, we're creating online training modules to help local health agencies get skills in risk assessment, toxicology, risk communication, and brownfields and hazardous waste sites.
If you would like additional information on how state health departments can get involved in Brownfield's redevelopment programs, please go to the next video in this series.